Hello, my name is Kelsey Marks, and I'm currently a registered nurse in hematology and oncology. I'm studying to be a family nurse practitioner. Porphyria is a chronic hematologic condition that interests me because it's fairly rare and not well known in the medical field. The main purpose of this video is to increase awareness and knowledge of porphyria and to provide familiarity with the resources of the American Porphyria Foundation's website. This website is created by the American Porphyria Foundation, and it has a SEER score of 3.8. But before we tour the website, I just wanted to provide a brief summary on porphyria and the impact it can have on families. So porphyria is a metabolic disorder resulting from the malfunction in heme synthesis. This results in an accumulation of metabolites of the heme synthesis pathway called porphyrins. Porphyrins accumulate and cause toxic effects, and there's actually 8 different variations of this disorder. So they are separated into acute and cutaneous porphyrias. They either will typically cause acute nervous system symptoms or skin symptoms with the cutaneous versions. The most common symptoms are red or brown urine, severe abdominal pain, nausea, vomiting, muscle pain, weakness, paralysis, confusion, hallucinations, paranoia. More severe ones are seizures, neuronal degeneration, and burning pain and blisters from sun exposure. The acute porphyrias are very rare. The most common version only occurs in 1 in 20,000 people, and these symptoms will appear quickly, they're extremely severe, and they'll last days to weeks. These attacks can actually be deadly, and they usually require hospitalization each time an attack occurs. The other forms are the cutaneous porphyrias, and these are also rare. The most common version occurs in 1 in 10,000 people. This version results in permanent skin damage, open portals for infection, and fragile skin. The red or brown urine symptom is common, and it actually is where this disorder gets its name. The Greek word for purple is porphyris, and in this condition, the excess porphyrins in the urine result in the red-brown urine color, and it's also noticed that the urine darkens after sun exposure. So if we go to the website quickly, this is the American Porphyria Foundation's homepage. This website provides information and summaries on porphyria in order to help those diagnosed with it. It also provides information about possible treatments for porphyria attacks. So say if you were diagnosed with porphyria and you wanted to go and get some more information on what this disorder actually entails, there's a fairly detailed description of each of the 8 types of porphyria. And that way you can look and see what's most common to the one you're diagnosed with. There's also each links here on the side for the other ones, and it'll describe the genetics of it, since it is usually either autosomal dominant for 4 out of the types, and then 2 are recessive. So then possible treatment options, if we look down here. This one's most interesting, I think, because porphyria cannot be cured. Mostly you just focus on the avoidance of triggers. Triggers for attacks can include medications, alcohol, stress, dieting, menstrual hormones, and sunlight, so fairly common things in everyday life. Treatment will focus on symptom management, and it's also encouraged to have steady carbohydrate intake, because reduced carb levels are shown to induce attacks, so they don't encourage eliminating this from your diet. So like people who go and do the Atkins diet are extreme risk for attacks of porphyria. So the one medication that can be given for porphyria is this panhematin, or also known as heman. So heman is a blood product derivative used to prevent acute porphyria attacks from being critical. Before you get this, it's usually you get a large carbohydrate loading dose prior to this, and that's like 400 grams of glucose per day. The heman has to be given through a central line and then followed by 100 milliliter normal saline flush. So it's not like this is just a quick in and out treatment. It'll take at least a couple days, and you can get it for 4 days straight if it doesn't help resolve the attack. So I thought this website included a great description of possible treatment options and then a very thorough article on heman. So this is just a description, but if you continue reading, it'll show a video that describes the administration for Heman. Let's scroll down so we can find it. And then I thought this video actually might help ease families' anxieties about receiving this medication because they'll be more familiar with it. So that's kind of shows you what Heman looks like, but we'll go back to the PowerPoint quickly. If it'll change slides. So that's actually what Heman looks like. It's black. Patients, the first time they see it, they're like, "You're putting this in my body," but it actually helps quite a bit. So let's go back to the website if I can figure out how. Sorry. So the other great tools that this website entails are a medication database, since many medications can trigger porphyria attacks. This database is user-friendly, and it provides a quick method for checking the safety of medications. Having the knowledge of this resource might help families reduce the occurrence of porphyria attacks and thus reduce the needed frequency of hospitalizations. So just to show you how simple this system is to use, let's look up a couple medications. So since nausea and vomiting is a really common symptom during an attack, we'll look up Zofran. We just have to accept the terms. So the brand name will be Zofran. And then it gives you a key here off to the side that'll tell you, so Zofran is okay, and it's very likely to be safe. So by doing this quick search, we find it's okay to use Zofran. So let's say you're having nausea and vomiting at home and you're trying to avoid going to the hospital. So you go to the store and you try to find an over-the-counter antiemetic such as Dramamine. So we'll search that quick, and it says that it's bad. So this is fairly unsafe with porphyria, and if you take this, it might cause an attack. So another medication we can look up, another scenario, would be, say if you go to the doctor with like an ear infection, they might prescribe Bactrim since it's a fairly common antibiotic. So we would quickly search that. And this shows that, again, it should not be taken when you have porphyria. So being able to quickly look up medications and determine their safety allows people diagnosed with this condition to make informed decisions on what medications to take, and then when they need to take, discuss other options with the provider. I've seen actually providers use this resource in the hospital when patients come in with porphyria, just because they aren't familiar with what types of medications they can prescribe for these patients. So I think it's fairly helpful. So porphyria, it's a chronic illness, but since it's genetic, many family members could be experiencing this at the same time. So especially siblings, a lot of times siblings have porphyria, and triggers could be exacerbated at the same time. The family might have to limit outdoor activities, such as sun exposure, just because that could be a trigger. And then many medications, as we just discussed, are unsafe to take, so it's important to research all medications. And then especially for parents with children with porphyria, the parents might find relief in researching the medications. And then again, the acute attacks of porphyria require hospitalization to prevent permanent damage. And this makes it difficult to work steadily and can result in financial stress to families. So this stress in itself can lead to spouses or main support systems having caregiver burden, which is the hardships associated with caring for a person who's often suffering from a medical condition. Since there might be financial strain or stress involved. So say if a child has to be hospitalized frequently with porphyria, a parent might decide that they are unable to work and must stay with the child. If the parent has porphyria, they might have to frequently take leave from work just to be in the hospital, so that leads to financial stress a lot. So going back to the website, it also includes a support group. So there's actually a support forum for caretakers and family members who have porphyria. And then for children who are affected, this is good for parents to find. They have this support group called Shadow Jumpers. And basically the idea behind that name is that these children have to stay out of the sun, so they jump from shadow to shadow. So it's kind of neat. It helps them feel more acceptable for having a chronic condition, more included. And then if you keep going, there's all sorts of resources and stories and just stuff to help these children get through having a chronic illness. And then it just helps find support systems for both children and parents affected by this. So, in summary, porphyria is a rare metabolic disorder that results in an accumulation of porphyrins. This accumulation can be triggered by sun exposure, medication, stress, diet changes, and alcohol. Management of attacks usually requires hospitalization in order to manage symptoms and prevent long-term complications. Living with this chronic illness can be stressful to the individual, the parents of an affected child, and to the entire family. Resources, such as the American Porphyria Foundation, are important in managing and coping with this illness.